Recorded. Good morning, good afternoon, depending on where you're joining us from today. My name is Tanya Lewitt. I am the president of Alternate eSource, and I am thrilled and honored to be here today with a panel of distinguished expertise. Joining us today for our session of leveraging IoT during these COVID times is my esteemed partner, Brett Martin, who is the Business Development and Chief Solutions Officer for Alternate eSource. Thanks for joining, Brett. I am honored to present Dr. Catherine Grilette, who has a thriving medical practice in Silicon Valley, and I appreciate that you've made time today to join us. I understand also you've done some great humanitarian efforts globally, and honored to have you as our guest. Dr. Steve Datna also joining us today. Phenomenal work in AI, is the CEO and founder of a company called Achilix that's working with AI now, as well as an educator in trauma surgery. So thank you, Steve, for joining. We also have with us today the CEO of Help SaaS, Frank Ely, that's been doing some amazing work in and around the solution suite. So thanks again, all of you, for joining us.
Thank you.
Thank you.
So today, we're going to be looking at IoT solutions. For our IoT Slam audience, we will be touching today on the entire interconnected community of devices and their capabilities. We're going to look at edge sensors, how they generate and commute data. So basically smart devices, again, making our world easier, work smarter, not harder. AI for the analysis that AI can provide, but also from a perspective of screening and triage and monitoring. So different perspective today for the use of AI, as well as 5G. The communications is what's important when we derive the data. The data needs to be available for everyone and everywhere, and needs to be in real time. And we, of course, are the intelligence part of that data to make the intelligent decision as to what to do next in the case of our IoT solutions. So this morning, I'm really fascinated with the aspect of AI and the work that you've been doing, Steve. So please tell us a little bit about that today.
Thank you. So you see a slide up here, which is kind of interesting, is this project is an interesting example of the power of sort of multidisciplinary or interdisciplinary projects. In dealing with the COVID-19 crisis, one of the things that was found early on, as they were exploring how this virus attacked the body, it became clear that one of the main avenues of invasion in the body was through attachment to these, what we call ACEs2 receptors, which are important receptors the body has for the regulation of blood pressure. And as you can see from this slide, they're pretty ubiquitous. They're found in all sorts of places in the body, which also helps explain the wide range of symptoms and signs that patients with COVID can experience over time. But the interdisciplinary part of this comes in. If you look at onto the right side of the screen, there's one of the images from the thermal imaging scanner. And as we were introduced to this technology of high resolution thermal imaging scan of the face, it became apparent that there might be other opportunities to use this technology than just using it to measure whether the patient was febrile or not. So initially, the algorithms that they were looking at were to determine with high confidence what the patient's temperature was. But because the image was so high resolution in the face, it was possible that we might be able to see other things other than just the temperature. And because if you look at the location of these ACEs receptors where the virus might attach, the question came up as well, if these virus particles attach to these receptors, would that cause local inflammation? Typically, it would cause local inflammation, and local inflammation causes an increase in blood flow. Increased blood flow should potentially show up in a high resolution scan as additional hot points. So that's kind of what we began to think about is, could we use this technology to not just identify whether the patient had a fever, but could we potentially identify the early stages when the virus was first entering the body?
That's fascinating, Steve. I'd really like to take a look at a little bit more about the thermal image. So can you speak a little bit to what we're seeing here?
Yes. So again, you kind of look at the top two images. Initially, the goal was to have a very accurate measurement of patient temperature. And as they'll go in, the experts in that area will go into in greater detail in a minute. This provides a very reliable, high resolution, highly accurate measure of body temperature. And the first two pictures give you, one is sort of the normal, where the patient is has no hot spots in the thermal imaging scan. And below, where they have a lot of hot spots, and this can be translated by the AI within the thermal imaging system to determine that this patient has an elevated temperature. What's exciting, though, is the third image as well, which is, what about those patients who have hot spots but aren't febrile? So that's what we were talking about before. As you can see, there are some hot spots that show up that don't necessarily correlate with an elevated temperature. And so that's been an area of investigation and interest of ours, is can this, or does this potentially represent a subset of patients who may be asymptomatic with the infection? Now, there are other reasons a person can have inflammation in the face as well, but we're basically looking for, can we identify a third group of patients who might benefit from more intense scrutiny?
Yeah, it's pretty amazing technology. I mean, it's basically seeing with a different set of eyes. And what I understand is that this type of imaging is really relatively new. And I'd like to look at this technology versus the tool sets that are available today. Maybe Brett, you could speak a little bit to what we're seeing and what's out there today.
Great, thank you, Tanya. Appreciate it. I think everybody's question on the top of their mind today is, when can we reopen? And I think the question should be probably properly reframed as, how can we reopen? And I think that's, again, why we're here talking about IoT technology and how it can be applied to this particular application. As Dr. Datna said, the primary intent for this platform was to do a binary, high temperature, normal temperature kind of a scan, and we've discovered that there's something in between. And I think that's where the IoT community comes together with the multiple disciplines here again that Dr. Steve Datna just mentioned can bring us to. But let's see SmartXcan in action. Frank, if you wouldn't mind playing the video. So while the video is playing, what you're seeing here is a technology that is touchless, automated, completely integratable with IT, extensible with other IT systems, efficient and secure. And I think addressing all of those issues provides us a platform where we can hopefully move forward from this threat of COVID. So now that you've seen the SmartXcan in action, let's just take a few minutes here, or just a minute or so, and look at historical solutions. And I think, some of the technology we're using today, people have come in contact with, handguns held to the forehead, taking a temperature reading. Some of us may have been exposed to mass camera sensors where, a camera or a tablet product is basically taking a wide scatter picture of a large group all at the same time. The interesting part about that technology, it was invented in 1869. The first use of infrared was actually developed in 1899. So we're looking at historical technology that's now been in use for over 120 years. And I think the way technology has moved on, it might be good and useful to ask ourselves, why would we still want to use 120-year-old technology? It may be effective, but is there a better way? And I think SmartXcan is the better way. SmartXcan is based on an element known as germanium. It has been used in data centers to detect heat plumes in servers and server racks and things. And SmartXcan today has been retuned to look at the inner canthus, which if you listen to the FDA and if you listen to Stanford Medical standards that have emerged over the recent years, they both indicate that you should be looking at that location square between your eyes, a few centimeters deep inside your skull to get the most accurate body temperature. Couple that with some information from the IPVM folks, an industry standards regulating body for thermal imaging devices, also say the same things, look at the inner canthus, but they actually also further specify that you should only be taking an image of a single person, one at a time. You should do that without glasses and hats. Masks are okay. And you shouldn't be near windows or doors or any other heat source or cooling source that could affect the background of the imagery and therefore maybe affect the image itself. And again, they're on page with the FDA and Stanford's declaration of use of the inner canthus for the most accurate body temperature. So as we look at this, our mission here is to bring SmartXcan to everyone for a thermal detection. And again, make it touchless, automated, efficient, make it integrated to other IT technologies so it can be used throughout a corporation and quickly and transparently transit data back and forth and make it secure and extensible. Can flip to the next slide, please.
Yeah, so what I'd like to point out here, this is not just temperature measurement. This is a new way of doing thermal imaging. We're kind of on a new frontier of that, as well as because it's a smart device, it has a lot more capability. So I'm looking forward to hearing some more about that now.
Yeah, so today's devices, the handhelds and many of the infrared camera technologies are standalone technologies. And of course, you could use the SmartXcan here as it's shown on the left in a standalone use case. And there are many practical applications for it. One might just be in your doctor's office or sitting in a single location where you have people coming in that aren't associated with you, but you'd like to know what their temperature is as they come through the door. And there are a great number of other cases whereby you'd want to integrate it with the IT solutions, whether it's for door access control, the passage of data to a security person, human resources, maybe even if there's RFID used, and the SmartXcan can use RFID to announce your approach to the building and their after control door access. So if you have a positive scan, you're okay. Great, the door unlocks. If it turns red and you have a negative scan, you've got a fever, the door remains locked and you can't get in the building. So we could actually tie this to other systems and create a systems of systems approach to deploy a SmartXcan. But that also allows us then to take that data and offload it into other applications like AI, like RPM, and you'll hear about that in just a little bit, but you can also tie it to things like presence counting and passage counting to know how many people are in your building and how many people are in certain areas of your building, and also be able to maintain social distancing. So there are other technologies that can be tied to this that allow us to see how close or how far apart people are in a given space, to then possibly tie that to digital signage, audio output to tell people to break it up and maybe do a little bit better job of social distancing in a given space. So with that, I think it may be instructive here to introduce Dr. Kathy Grilette, who's been a user of SmartXcan, and let her describe her experience with us.
Yeah, you've had a unique experience with this technology, and we're very interested to hear what you have to say today. And thank you again for clearing your schedule for us. Appreciate it.
I'm Catherine Grilette. I'm an internist in Los Gatos, California, in private practice for over 30 years. I graduated from Rensselaer Polytechnic Institute and attended medical school at Albany Medical College in Albany, New York. My residency was completed at one of the Yale affiliate hospitals in Danbury, Connecticut. After finishing my residency, I was then appointed a clinical instructor for Yale, running a medicine clinic and teaching medical residents. Being in private practice this last year has been very, very challenging. There are a lot of restrictions, patients who think they're sick, patients who don't think they're sick and they are sick. So it has been a challenge for all of us. I had decided that I should donate blood. And while I was donating blood, my mask was removed from me, not by my choice. And it was off for over 20 minutes. There were many other people there who were not wearing masks at the time. And this is shortly after Thanksgiving. So I sort of got caught in the Thanksgiving surge. A few days later, when I'd come to the office and I had done my regular radar thermometer, I was normal. And when I did SmartXcan, it showed I was running a slight fever. I immediately went home, started isolating, started masking at home, and contacted Stanford to get a nasal test. It took 2 days to get the nasal test and 5 days to get the positive result back. But all that time I had isolated so as to protect my family, my staff, and my patients. I ended up being at home for 2 weeks, also developed a pneumonia. And that whole time, Stanford never wanted to see me in person. Everything was done virtually, checking my blood oxygen levels, my temperatures. But I attribute SmartXcan to basically saving my life. Hydration is really the key. Hydration and making sure you're well fed during this time. The average person who's admitted to Stanford usually has had a fever for over 8 days and comes in dehydrated, volume depleted. And that's really when they get into trouble. I have to say that after a total of 4 weeks, I came back part-time after 2 weeks. And then after 4 weeks, I was able to resume work full-time and not having the COVID long haul that people are talking about. But I do attribute SmartXcan to saving my life. And I found it far superior to my radar thermometer.
Wow, that's a phenomenal experience that you had, and I'm happy that you're well, and I'm happy to know that there is technology. Again, we're on the forefront of this technology to be able to do things in a better way and to see things in different ways. I'm just looking at your scan here, and I find this fascinating. Steve, you know, this is what you were talking about earlier when you were referring to a variety of hotspots. I mean, here we're looking at a scan that actually has something brewing. It's a phenomenal piece of imagery.
Yeah, and I think,
And particularly no symptom other than that slight fever. There were no other symptoms. My symptoms did not appear for 4 more days.
Well, we're really grateful that it was able to service you insofar as that you were able to get attention immediately. And, you know, there's something to be said. Again, we're in new ways, new days, where we know that we're supposed to be, you know, being separated. We know we're supposed to be washing our hands, but we really don't know what we are carrying. We might feel fine. So this is just a phenomenal experience that you've shared with us. And I really do appreciate your expertise. And I wanted to take this a step further. You know, we haven't heard from you yet, Frank. And I wanted to talk a little bit about how you've incorporated, you know, normally in the past, IoT has been kind of this sort of siloed, you know, technologies where you try to put them together and have them work for a in a better way. And I have utmost respect for you, Frank, and what you're doing here is you've basically orchestrated an end-to-end solution that just makes common sense. So please speak to us about that, Frank. Thank you.
You bet. Thank you, Tanya. And as you can see here on the slide, I can't take credit for this alone. This has been a strategic partnership with Steve Akilix, bringing both his clinical background as well as his expertise in AI. So if we look back a year when COVID first surged in the US, HealthSAS and Akilix collaboratively launched a COVID-19 assessment tool. You can find that at covid19checkup.net. Now, this is an AI-powered solution. This is not a chatbot, not a decision tree solution. So as you're going through that and you answer questions, the next set of questions that will be presented to you can be based on some of the information you've already provided. Now, as you finish that assessment, and we're looking at this in context of going to a venue, right? A venue could be your work, a school, an event such as a sporting event or a concert. If you take the test or the assessment, you present as low risk, you proceed to your venue. But perhaps between the time you took the assessment and the time you reached your destination, something has changed in your body. You do the bout of the scanner, it detects something is not right, whether it may be a positive fever or something else of concern within the thermal image itself. Now, the interesting part of this is, when you look at the rest of the industry where you see these siloed, disconnected solutions, this is truly a collaborative effort that offers a structured, comprehensive end-to-end solution. So we're tying all this data together from step 1 through step 4. It's going up to the cloud in a product HealthSAS calls CarePath RPM. And so as you go through step 2 and you see that positive scan, one of the things that we do is provide a recommendation to individuals as far as what the appropriate next steps could be. And obviously one of those steps could be a nasal swab. Should you receive positive results from that nasal swab, then we can recommend that you utilize our remote patient monitoring solution for COVID. And it's a pretty interesting solution, I think much more advanced than other things you're seeing in the industry. So what we will be launching in the end of Q2 is a watch type device that's cellular enabled. It can monitor your heart rate, your body temperature, SpO2, et cetera. So now instead of having a phone and external peripherals, you have everything monitored on the wrist. So very simple, ease of use for anybody. Now, what makes this even more interesting is that data is then processed, it is sent to the cloud, where it is analyzed, and we are able to present subjective questions to the patient. And this is where things get really interesting. And I'm going to ask Steve to talk about that clinically, why taking data and coupling that with subjective questions to a patient that then can present refinement questions based upon the data and your answers to those questions, and why that is so important in the carrying in place of COVID patients. Steve?
Thanks, Frank. Yeah, so traditionally, remote patient monitoring has been about monitoring device data. So it's looking at numbers and providing that information to clinical teams to analyze. What we're doing here is we're sending the numbers to the AI system to let it do a pre-screening of the information and a pre-analysis of that data. And the AI then can reach out to ask questions of the patient themselves. And what that does is it puts the numbers in context, because numbers in and of themselves may be useful, but if we put them into the context of what the patient's doing, how they're feeling, other signs and symptoms that go along with it, then the quality of our assessment goes up. And we can do a much better job of triaging these patients, combining their telemetry with a sense of what they're actually experiencing is a much more useful data set that can be pushed upstream to their clinical care providers.
Thank you, Steve. One of the other interesting things about this, depending upon the use case, so when we look at a scenario of, say, a college campus, so when a student or administrative staff, as they go through the day, perhaps go from building to building, they start the day with the assessment test. They go to a building, they do a scan, it's all good, they go to class. But by the afternoon, they're in another building, in another class, something has changed. And so we're able to track this data longitudinally. which is really, I think, critically important. And I'm going to ask Steve to talk to this a little bit also. And so one of the things we can do with that data is also the contact tracing aspect of this. So when a student or faculty is in line, and if someone does have a positive scan, we know who was in front of them, who was behind them. The appropriate measures can be taken to alert those others that were around them. So, as we look at this as a full end-to-end integrated solution with data going to the cloud, being processed by AI, creating awareness of positive patients, being able to put them in a situation where they can monitor or care in place at home or in a specific dorm area. That's, I think, a very interesting offering to the world as a whole, quite honestly. Steve, any further commentary?
No, Frank, I think you've hit the nail on the head. I mean, I think part of what we're also able to do with this isn't just a one-shot sort of isolated assessment. This can be basically part of an ongoing assessment record of an individual throughout the course of this pandemic. So we can, if they're hooked up to, like you said, with RFID tags and so on, a record can be traced for each individual, so that we can do, that information may be very, very useful retrospectively as we try to analyze exactly the clinical course of this disease. Having that sort of longitudinal record of what's going on these patients on a day-to-day basis will be very valuable.
I think it's incredibly valuable. And I just wanted to interject here a little bit. Some of us in the world are breathing a sort of a sigh of relief, Steve. There's vaccines out, but we're learning that the vaccine is not going to protect us 100%. We're learning that there's differences within those vaccinations. We understand that there's new variants that are out. And, a lot of people talk about herd immunity. I don't know that that's going to be enough. Again, we need to really be prepared. So I wanted to see, if you could speak to that a little bit as well.
Sure. I think, hopefully we're getting a handle on this particular pandemic. But one of the things I think we realize is this has been a long time in coming. It's one of the downsides of the globalized world we live in, is that we are more susceptible as a world to this kind of thing. And this isn't the last time we're going to have to deal with this type of public health emergency. So I think, what we can do now to learn from what's happened during this one will better prepare us for the ones that'll come in the future.
Absolutely. We owe it to the families that have lost loved ones during this time. And certainly this pandemic has allowed technology to be present and to be explored in these new ways. And, again, like you said, we need to be better prepared for the, for the next time, for any time. And I believe here we have a combination of technologies that can actually take us on a new way of looking at different types of imaging. I think we're just still on a new frontier, and really, really excited about all of the discussion here today. Thank you.
So Tanya, I'd like to add one final point, because I would assume there's some question out there. Where does the data go? So obviously, as I mentioned before, the data does go to the cloud, to a collaborative solution that HealthSAS and Achilix have brought to market. But the importance of the biometric data combined with the answers of the subjective questions, it can create notifications to an individual's care team to provide early interventions if necessary. So should SpO2 drop to dangerously low levels, body temperature escalates upwards, that will create the notification to that clinical team so they can reach out to that patient, provide the appropriate guidance, which could be anything from a telehealth visit, so your online visit between clinician and patient, urgent care, call 911. So this is a truly integrated solution to provide full care for an individual to mitigate any of those concerns as they navigate this disease.
It's a phenomenal technology, and I just wanted to thank everyone for their perspective here, and Dr. Grilette, certainly the experience that you've had that this technology was able to provide you that early warning system. I'm excited to see what we can do next as we go forward with looking more at the AI, looking more at the data analysis. I'm looking to see how we can even perfect devices in the SmartXcan, be able to have them be even more integral going forward in the way that medical community is changing, that healthcare is changing in general.
Great.
So I want to thank everyone for their time today. We have here information. Please drop us a note at the respective companies. And what I will also say is, this is a time that we need to collaborate. We are an IoT community. It is the strength of collaboration together that provides the next successes with technology. We need to have that heightened awareness, and we also need to be aware that 15% of the global population looks like they will never even see a vaccine, and we don't know what's around the corner. So I'm going to put out a short call to action here. Join us, collaborate with us in our pursuits. Are you a technologist? Are you a clinician? Do you work in research, or are you a data scientist? It's really important to have the feedback from you, the audience, as well as the ability to collaborate further to expand the devices, to obtain better data sets for efficacy, to improve the time to market for these new IoT type of devices and systems, and also to reduce the burdens of resources, whether it be ICU capacity, operational budgets, my gosh, coming down to saving lives. I thank you so much. This has been such an exciting journey, and I look forward to working with all of you still in the future here to see what might be the next best thing, and appreciate everyone's making time to schedule us for our IoT Slam community. Thanks again.
Thank you.
Thank you, Tanya.
Thank you.